Welcome to the Healthy Mind Chat. My name is Hasan Ali Khan. I'm a health communicator from Northwestern. At Healthy Mind Chat, it is the place where health and communication intersect. We speak about health and healthcare, all the aim to inspire healthier minds, one conversation at a time. And today, we would like to reflect about the year gone past. We are coming to 1 year since COVID-19 hit US and the shores of United States of America. What followed could only be described as chaos, and 1 year later, more than 500,000 Americans have died due to COVID-19. It was also a year of protest, a year of elections, a year of many interesting issues, debates, and reflection. And today, this first conversation in Healthy Mind Chat, is a conversation of reflection of the year that has gone past and the lessons that we have learned. And as the COVID-19 vaccine is being enrolled in America in the way that it is, what does that mean for us? What are the things that we should be focusing on? And today, I am delighted, excited to have a dear friend of mine to join this conversation, to speak about all of this, reflecting on it. Her name is Deidra Jackson. Deidra Jackson is the Associate Vice President. Let me get this straight, Deidra, I don't want to get this wrong. She's the Associate Vice President of Market Products at Healthcare Service Corporation, which is the fourth largest health insurance company in the US. She is focused on affordability, access, quality of care, and patient engagement and safety. She's also a fellow health communicator from Northwestern and a friend and colleague from class. Outside of work, she is a community activist. She's a longtime resident of Oak Park, Illinois, just out on the outskirts of Chicago. She's a mother of 4. She's a dog mom as well. And recently, part of the protest movement that was happening, she was one of the main organizers of the Walk the Walk initiative, and they had a great, amazing protest movement going on the west side of Chicago. So welcome, Deidra.
Well, listen, thank you so much for having me. First of all, it's always great to speak with you, and we always fall into such deep conversations. Most often not on camera.
That's true.
Here with you, and also congratulations to your first episode.
Thank you very much. Thank you very much, Deidra. And it is actually conversations with you and other colleagues of ours that has really given me the oomph to actually have these conversations, record them, because I think they're important conversations that need to, hopefully that can benefit other people. So Deidra, Saturday morning, right, with just coffee, right? And not that one wants to speak about somber things, but I think with the times that we're living in, let me start off the conversation with the year gone by. What are your immediate thoughts and feelings about the past year, COVID-19 lockdown, protest movements, elections? As an African-American lady, mother of 4, an activist in the healthcare world, what does that all mean?
Wow. Well, honestly, Hasan, it's until you put it all together that you really see the magnitude of, I guess my perspective, or the lens that I will take and have as a mom and a healthcare executive, et cetera, et cetera. It's interesting that you open the question and saying, I don't want to talk through a somber topic. I don't know if it's lenses, right? Because certainly the year was very somber and had many, many down points. Conversely, I would say there were also many highlights. Highlights for us to reflect on as, a people, whether it's through what's happening with COVID, and that shined a light on our fragility of the healthcare delivery system across the board. We were simply not ready. Whether it then shined a highlight on those communities that we've known we've left behind, but now to see the impact of those who are truly living that day to day and dealing with those social determinants of health and comorbidities that they struggle with. Whether we think about the, systemic racism constructs that this country has been founded on and continues to perpetuate year over year. All of these things come together, honestly, I think for the greater good over time, though certainly there were events and situations and circumstances that happen that would certainly make us somber if we don't, I should say, maybe create positive movement from what occurred. And that's really what I've been trying to focus on over the last year. This last year, quite frankly, for everyone, for me personally, was a kick in the pants, right? One of which, do your best and leverage your talent, not only for yourself, right? As Americans, we spend so much time. It's something that my mother says, that, a mindset that people can have, me, my four, and no more. Right. And that's a very American mindset. But to grow beyond that and to think about the greater good and your responsibility to it, I think this has been a great year for that.
Okay, I love that perspective to be able to. I think you're, as you describe yourself, a constant learner, and think for the constant student, it is almost important to continuously look at the opportunities, despite the challenges that come. But to expand on the fragilities, what was exposed in this year?
Simply put, we were not ready. The list goes on and on. Let me rattle off just, top of mind, what comes to mind in that. We're not ready to take good care of the American population as we should, right? And whether that is, I think it highlighted the necessity on primary care and the need for that and the deficit that we are at. We're cranking out specialists, left and right, but specialists could do nothing in the face of COVID, right? And I think it shined a light on that. I think it shined a light on the capacity in the system. What would stress tests? Have we ever had to stress test the American healthcare delivery system like we did, with, in healthcare, what we talked a lot about was, while yes, we want to prevent and keep everyone safe, wear masks, social distance, those types of things, the truth of the matter is, and again, my opinions are my own on this show, let me just the truth of the matter is, I think it was, trying not to inundate the system all at once, right? How many beds, how many respirators, how much PPE equipment do we really have to serve the American people, right? And it is better to stagger that than to get it hit at one lump sum, if that makes sense. So I think it shined a light on that. I think it shined a light on the supplier and the supply and demand chain and the supply chain that supports our healthcare system. I think it shined a light on us and the fragility that we have just simply as people to react, right? Our emergency care, our infrastructure, those things like that. I like I said, the list goes on and on of the fragility that it showcased, and I think what the undercurrent of it all, right? As a humanist, right? These are that I think about, but the undercurrent of it all, I think what it exposed, quite frankly, was, the fragility of the human nature and the human, propensity to care for others. When we were all sheltered, and sheltering in place, we had to deal with ourselves. We unmask ourselves. We had to reflect on ourselves. And we don't deal well with isolation, right? We are a being that's meant to be social, that's meant to be connected. And I think with that, good came of it, right? We had nothing to do but to sit down and pay attention. There was no sports in the Coliseums being played, right, in the Roman days. Mm-hmm. There were none of those things. And so we really had to sit back and reflect on this great states of America and across the world of what we had built.
Okay. Absolutely. And in terms of, as in for me, it's a lot of what you said, comes home in terms of human fragility. This idea that the COVID really exposed how well or how not so well we are connected, despite this whole social media thing and this idea that we're all connected through all these
Sure.
interfaces. But it's when it comes down to it, and I think any healthcare practitioner knows that, especially for me, someone like me who's a medical student trying to be a doctor, that you cannot replace human contact.
Yes.
And COVID-19 and everything that happened really showed how sacred and how important these relationships are and how healing they are, and the lack
Yes.
of them. And I think we learned this something in health communication, that one of the worst forms of torture is isolation.
Yeah. Neglect.
And neglect. And that someone forgets who they are because simply there's no one else to communicate with. And so obviously there's this mental health burden that has come with COVID-19. Specifically speaking about your area, Oak Park, where and you can tell me more about, I assume in that area we have more African American communities, and I've kind of worked on the west side of Chicago, and I have seen disparities there.
For sure.
Particularly for the community there, was this what happened in COVID-19? Was this just a continuation of previous experiences, the neglect, the being forgotten? I was just listening to a podcast where St. Anthony's Hospital, also working in the African American communities and providing the to the Latinx community, that the head nurse was saying that we were struggling, whereas the Northwesterns and the University of Chicago's were just doing fine peak COVID. So specifically for the minority communities, is this again a continuation of ongoing structures and neglect, or did COVID-19 tell us something new?
No, I quote my parents quite often.
Mm-hmm.
My dad, there's nothing new under the sun.
Mm.
And that is absolutely true. It's interesting that you mentioned where I live, which is in Oak Park. So to describe it and paint it a little bit for you, just to give you background of the area. Oak Park is a small community right outside of the west side of Chicago.
Right.
It's very close to the Austin community at one point. In our history, Oak Park and the annex of Austin were in fact joined.
Mm-hmm.
Oak Park is a place of, some would say high diversity. Mm-hmm. Certainly my family moved into Oak Park in 1976, in theory, some of the first Black families here, but that is not true. We know that Black settlement, dated back well into the early 1900s here in Oak Park, not welcomed, and migrate out due to, racist constructs and behaviors, et cetera. And then slowly but surely made its way back where you'll have some African Americans and other diverse folks here. Hasan, we are but a stone throw away from the Austin community. In fact, I grew up one block away. And if you drive up the Austin Boulevard, turn left, and if you're driving south, I lie, if you're driving north on Austin, turn left, you turn into this amazing, beautiful community. Kids are outside, everything's safe, they're planting leaves, the parents are walking them to school. That's Oak Park. You turn right and you're smack dab in the Austin community, one that's plagued with gangs, one that's plagued with a history of drugs, one that's plagued with a warm and loving Black community. So I remember growing up, walking across the street to the candy store and to buy penny candy and ice creams and snow cones and pickles and all of those things that are rich in the fabric of the African American culture, but yet we live so apart. The segregation that and I've been doing a lot of work on this, the segregation that plagues Chicago is, well, I think Chicago is one of the top, in the top 5% of the most segregated cities in the US, and segregation comes at a cost. When you're in segregated cities, you're most likely to have less college graduates, and that's across the board, particularly in minority communities. You're more more prone to have violence, et cetera, and the list goes on. So do I think COVID showed anything new? No, I think it exasperated an already exasperated situation, right? I have had, of my colleagues, right? The only colleagues that I have that have lost friends and family members to COVID are me and my Black colleagues, to be frank, that I know of.
Gosh.
I mean, that says a lot. So even when you aren't of the inner city and of a certain social economic class, right? America certainly struggles with classism more than anything, if you ask me. We are still impacted that much more, right? Spent the last year, Hasan, creating what I'll call psychological safety for my team at work. And when the George Floyd, on top of COVID, right, you're already dealing with that, right? I lost my first family member at the end of March last year, and the second at the beginning of April. And that's exactly the time that the George Floyd murder occurred as well. And people were holding on by a thread. And if I'm more candid about who those people are, right, and to name it, you can't broad brush everything, right? We want to broad brush, the Blacks and the Browns, completely different backgrounds, histories here in America, issues that they are plagued with. There are certain minorities that I would call and phrase as the acceptable minorities, nonetheless minorities, not quite white, not quite meeting that standard of rightness, but certainly not the bottom of the barrel in which we find our Black Americans. And I spent the better half of the year, like I said, creating that psychological safety, having conversations and opening up the dialogue for my entire division or of which I support, to just simply talk and connect. For, my team members who live in downstate Springfield or who have lake houses, and were able to escape, and kind of isolate due to COVID in a great way, right? Still enjoy the fruits of their labor, certainly, and of their affluence, of their privilege. These things. And then I also had team members that lived in the very inner city of Chicago that had to deal with the unrest, the upheaval of a city, of a nation. Team members that reached out, Deidra, I don't know my city anymore. I can no longer walk to Walgreens. I can no longer, like, a city on fire, quite frankly. And so when you deal with that and you take pause to understand what everyone's going through, no, I don't think that it exposed anything new. I think it was for all of us in our generation to live and take pause and act.
Wow. Firstly, sorry for the losses of your family. It's, and as you were saying this, the whole idea, I'm not sure how many of our listeners know about social determinants of health. The link of poverty, lack of employment, lack of access to healthcare, lack of just being happy in our day-to-day lives, not feeling safe in our communities, goes hand in hand.
Beyond having to survive.
Absolutely.
Happiness.
It goes hand in hand with just being healthy, being able to do the best that we can in order to live our lives, and to be able to then go beyond that. And it's almost that whatever happened in this year all came together in a way to tell us that human beings, wherever they are, whoever they are, we're all important. We're all worthy. And the question that was posed is, why are we not put in a position of worthy? Why are we treated as if we're not valuable? And then obviously there's the history of lack of trust. This especially when we speak about the Tuskegee experiment that happened, and as we speak about vaccines, which we will speak in a little bit. What with the conversations that you have in the spaces that you sit, what is happening in terms of paving solutions or starting to develop solutions to this? Although, which I can appreciate, is the history of America is the history of racism, right?
Correct.
It's one day and there's no switch to kind of necessarily to fix all of this. But where do we start? What is actually happening on the ground right now?
Great question. One that I'll take pause on.
Please do.
Before 2020, I'll just reflect a little personally, right? And just, Deidra, reflect on that before you give answers of all the things that's taken place, right? Before 2020, there were 3 times, Hasan, distinct times, Saturday mornings, just like this. So this Saturday morning, that I woke up so heavy with the state of America, so heavy with the future that my Black children could expect, particularly my 2 Black boys. So distraught at what they were seeing, and where we as Americans placed our values on money, on finances, on capitalism, not on humans, not on everyone has a value, et cetera, to the point where when I woke up, there was nothing wrong in my personal life, nothing wrong. Sun is shining, kids are healthy, me and my husband are well. In tears, woke up in tears, right? To the point where, I lay in bed with my husband and we talk and we pray and, make these things well, right? But my soul, quite frankly, was disturbed, to put it frankly, right? And there was one other time, so this is pre-2020, pre any of that thing. This is just American life. Then 2020 happened. And I distinctly remember being on a walk. I got up in the morning, disturbed. There were a couple of times I was disturbed right after the George Floyd situation, where I just got in my car and just drove around and saw the devastation and the destruction on the West Side. Another time that I just went for a hike in the morning. And it was almost like it was this weird situation, walking in and there was this illumination, like going through the Forest Preserve, and there was an illumination of light, and it hit me like that. It was as if God said, Deidra, your soul is grieving. What's wrong with you? So step back and what are you grieving? I think the lack of recognition, the lack of awareness, right? So as a Black American, I'm gonna say it this way and then clean it up after, but we do carry a bit of a chip on our shoulder, right? And it's because we're living an experience that no one else can live and experience, and also recognize that it is true. Do you know how maddening that is? Do you know a maddening state that produces, that you absolutely 100% know that someone is standing on your foot and it is aching and it is in pain and it has been stomped, and yet as if they say, no, you don't have a foot. That's not, that it's a shadow, right? You're having phantom feelings. That's not real. You're feeling these things of the past, of what you used to have. And that simply could not be furthest from the truth, right? And so that's very maddening. I'm sorry, my dog's snoring.
It's absolutely fine.
Is it? I'm so sorry. I should go shake him. He's a puppy. He's only 5 months and he's a snorer.
It's part of the atmosphere.
It's terrible. But, just to continue on with that. So, when I think about, that's what was, right? And that's the heaviness, and that's the burden that we trod, right? But I can honestly say in 2021, living through 2020, what's happening? That was your original question. That was a very long intro to say what's happening. I am encouraged because of conversations. I am encouraged simply because I can't tell you from the walk the walk movement that local neighbors and I in Oak Park created, where we wanted to do something. And Oak Park is a very liberal, we speak very well, we talk the talk, and the focus was to walk the walk. And so we took a group of 100+ folks beyond, many of folks who had never stepped foot on the West Side, and we crossed the barrier, that barrier that I described of left versus right. We crossed the barrier and we went through the West Side so they could see the level of devastation. They could see that all of the social determinants of health that you and I know that are there. There's no places where you can shop for groceries. There's not adequate housing. That, the list goes on and on and on, that they could see with their own eyes and experience. But from those situations, I can honestly say that the conversations opened up. It was almost like the scales of people's eyes began to fall off, and saw their country, they saw their countrymen, and all of us, right, in a different way. They gave credence to the experience that others were having. And many of them were like, hey, I don't understand, but I stand. That meant a lot. That meant we first could be seen and validated. I think that that's a very encouraging first step. I think those conversations and the momentum around that need to continue. A country is only as healthy as the least of them, right? So even when we measure like the effectiveness of our COVID vaccine rollout, right? I think the last stat that I recall, please don't hold me to the exact stat, but the last stat that I recall, that we were at some 9% or so of those eligible for vaccine on the white, in our white population, had been vaccinated. And I think it was less than half of that on your African American or your people of color. Mm-hmm. And yet they're the ones who are dying of it, who are struggling with it. So I definitely think we have to keep the momentum and the focus there. But I am encouraged by the conversations, and even what's happening on the private as well as the public sectors. And I think if we can all come together and do our part to stand up, to bolster and focus on equity, I think it will be a good, stride in the right direction.
Just to quote the statistic from Kaiser itself on its website, it says, overall across 35 states, the vaccination rate among white people was over 2.5 times higher than the rate of Hispanic people. That's 13% versus 5%, and nearly twice as high as the rate for Black people, 13% versus 7%.
Exactly.
There's a direction of a conversation I would like to go into, which I'm not sure, as someone who works in health insurance, I'm not sure you would have, but as in, my background in terms of, I started my medical education in the UK, and I was exposed to a national healthcare system where, if we do analyze what's happening right now in the national healthcare system in the UK, it's I won't say it's great, to say the least, but that's a lot to do with how the government really has handled it, because national healthcare system in the UK is a government project, to put it mildly. Here in the US, we found that it's almost every hospital works in a silo. Every clinic is a silo, especially now that when we speak about vaccinations rolling out. I've tried to get my parents vaccinated and eventually did. But the lack of information, but rather the chaos of information of how to just get something like a vaccine. My Walgreens and my pharmacy is telling me one thing.
Yeah.
My primary care is telling me another. Then I get emails from my local council telling me something else. And then obviously what we hear in the news and what the federal government says. As a health communicator, right?
Mm,
If there's so many things we could speak about, as a health communicator, about communications, messages and stuff.
sure.
How important is it that from and who should be the people of of distributing the right communication, whatever right means, and is that insurance? Is that going to be people's insurance companies? Is it going to be the primary care? And if we are going to have the right messages in order to have a coordinated effort, how would we go about doing that?
That's interesting. I mean, my opinions are my own.
Yes, ma'am. Duly noted.
Duly noted for the second time. Let's take a couple of steps back, right? And
Sure.
let's think about the roles at the base level, right?
Mm-hmm.
Insurance company, they are the payer. They
Mm-hmm.
pay for services. I don't know that we would expect our credit card providers to tell us everything that's changing in the financial arena, new product, whatever, yada, yada, yada. They pay for our consumption of goods. And I'm going way base level, right? Just unpacking it for myself to get to the answer. Quite frankly, I'm going through sharing my thought pattern.
Uh-huh. It's Saturday morning, Deidra.
It's Saturday morning. Let's go through it, right? The providers, right? They're providing care, and certainly they're professionals, and we expect them to have an expertise above what we would have as a normal consumer, and an expertise particularly about our anatomy, right? And so do I expect the provider that I'm going to know everything about the anatomy and the things that I present with as much as they can, as much as they're studied up on? Absolutely. Now, or should I have the same expectation that they would know all there is on new treatments as they roll out, on the symptoms, it's just so much, right? We're living in the day of information and boom and discovery and all the rest of it, that there are, new sciences and new treatment plans being crafted and created every hour, I would imagine. And can I expect you, Hasan, to stay 100% abreast of that? Right. I had a son that dealt with asthma, and you can go all in all about, the statistics around Black people with asthma and the treatment that they are afforded. As an affluent woman, completely fell into that box, right? And then there's the government, right? And their job is to take care of the people, shepherd, protect, do for the people. So I guess in my deductive reasoning, about the roles that these three play, probably as a consumer or as an individual American, look to my government to share and to provide that. Now, I'll say that behind closed doors and being in the insurance industry and on the payer side, the government, I think that they do a great job in healthcare. I know we sometimes we look at things in from just our lenses, but they drive innovation. CMS, HHS, the things that they roll out, quite frankly, it sets the beacon and the pace for the private insurers, right? Looking at what are they rolling out? They're rolling out new rules and regulations around transparency, around interoperability. They are the ones that are setting the standards, et cetera, et cetera. So if we could really fortify that already innovative engine and fix what's broken and correct what needs to be corrected, is that the place to start? I mean, I know I didn't answer your question, but I went through what I believe, how we get there.
Fair enough. As someone who's in the clinics, I guess, dealing with my patients. I think from a practitioner's point of view, honestly, I just want to help my patients, and anything that would make my life easy and their life easy. Um, as in, here in America, we speak about money in health quite a lot, which we do, but it plays such a important role in my day-to-day conversation with my patient. Unlike some of my colleagues or my friends back in, say, in the UK, where money doesn't really come up that much. But with that, I think most practitioners just putting money aside, they just want to do well for their patients, and it's the hope to get that help is just, can we have some coordinated
Yes. I think
help
now, who owns that responsibility? I think we all do. Somewhere in the middle is the truth, and that's why it evades us. Why it evades us, because as a payer, we'll go to this point and we're going to look from this lens. As a provider, you're going to go to this point and look from this lens. As a government body, can go to this point. Consumers trying to make sense of it all. So somewhere in the middle is the truth. I do think that we owe ourselves. I don't just sit as a payer executive or whatever. I sit as a mother. I sit as a daughter of aging parents. I sit as a sister of a schizophrenic brother. We owe it to ourselves as consumers and needs and needers, I should say, of healthcare, and adequate healthcare and adequate access and adequate affordability. Truth of the matter is, at the pace of what healthcare is going based on the GDP, what are we at? 3.5 trillion per year that we spend on healthcare, of which the government is the top payer of it all, right? So it's stressed. And I think none of us, over time, none of us will be able to afford it except for the absolute elite. I think another thing that this COVID and this year has done is, I'm going to be shocked when, another thing that I'm studying right now is the economic impact of what COVID is, not just on the healthcare side. Healthcare will be exacerbated for sure, but from an economics, I think we're going to see where we've always talked about where the middle class, the chasm between the haves and the have-nots, I think is going to, grow exponentially. I think, so when you think about those things, we owe it to ourselves, and we all have to do it, right? I think, being in our circle together, Hasan, it's definitely helped me to go back to the things that I do every day as I craft, benefits and services and doctors and providers in network, and how much will it cost, and negotiating rates and all of this other stuff, what the pharmacy, and I don't do it, and it's important for all of us, not that we all are there, right? I don't do it for myself. I don't do it for capitalism. I do it for my brother. I do it for my mother. I do it for you. I do it for, so when you take that lens and you want to break down barriers, you want to break down silos, and you first you have to be willing to do that. And then you have to reflect on, we stand on a very antiquated healthcare delivery system. It is not the intention. It wasn't intentionally built this way. Go back to before we had EMR systems, when I would go to the doctor, and it was all paper files. God forbid that I went to one PCP to the next PCP to my dental office, and so to translate all of that. And so once we pushed to, electronic or storing of information electronically, everyone created and built their own vaults. Right? In their own system, in their own clinic, same thing of us on payers, and our own little things that we had to get right, focusing very myopically on just our bubble. And now these bubbles don't talk and they don't connect. And there's billions of bubbles have to connect. And so I think it's a lofty aim for people like us that are in healthcare to truly strive to get it right. I generally have these big grandiose ideas, and I just want to save the world, right? And it was one of our professors, Dr. Lambert, that said to me, he's like, Deidra, my best Dr. Lambert.
Hopefully we'll be a guest on this show at some point. I'll let him know.
Rewind this clip for him. Deidra, would you really do that? Said, yeah, absolutely. He's like, you just have to make incremental change. Find your little thing. And he's like, you're going to tick it just a little bit. Tick, tick, tick. But you're not going to make these grand sweeping changes, giving the base for which we stand on. And, and it's easy to stand on one, the grass is always greener, right? It's easy to stand in this pasture and wish for the pasture in the UK or wish for the pasture in Canada. And those guys conversely wish for the pasture in the US.
Indeed.
So I don't think that any one country or system or provider or government or whoever has figured it out. I don't think any one entity has the full answer. I think it's a slippery slope when you're dealing with human. We're all different. We act differently. Human behaviors is 70% of what you and I deal with.
Absolutely.
The individual person.
Just remind me of that quote. What's that quote? A journey of 1,000 miles starts with the first step, right?
Exactly.
We are coming to the quarter hour, 45 minutes of the hour. A lot was shared. Thank you very much, Deidra. One final thought. I say the word happy or gratitude. What comes to mind?
Thankfulness.
Thankfulness.
I think to get to happy, to get to gratitude, one must first be thankful, right? And you can struggle to find things to be thankful for. I think that all goes into perspective and perspective taking. I heard a story of a little grandma who was taking care of, all of her grandkids. Let's just say she had 4 grandkids that she had to take care of, and they didn't have enough for themselves every day. They didn't have enough to make ends meet. But every day she sat with them and she asked them, what are you grateful for? What are 2 things you're grateful for? And she would write it down without them knowing. And she put it in a little jar. And then when times got really hard, that's what they reflected on. Produce a level of gratitude, etc. So I think that being thankful or being happy or having a sense of gratitude is a place of contentment. It's not something you attain. It's not something that you have. It's not something once you achieve. It is a state of being. I find it super ironic that as Americans, even the poorest of us are among the rich compared to, or when we think about ourselves as world citizens, right? Among the rich, even the poorest of us. But yet, we're also the ones that are most riddled with anxiety and depression and et cetera, et cetera. And I think the pressures are different, obviously. But I think, so if someone across the world that's living in a third world country that doesn't have shoes on their feet, that may or may not be able to be educated and be gifted with word and knowledge and all the rest of it, can find gratitude and thankfulness, certainly we should all be able to, but that's not the state in which we are.
Deidra Jackson, thank you very much for this wonderful conversation on a Saturday morning with snoring dogs.
Snoring dogs.
And to the viewers for watching this, thank you very much for tuning in, sticking to the whole hour of the show, and hopefully we'll see you in the next conversation here at Healthy Mind Chat with myself, Hasan, with another wonderful guest. See you then. Thank you.
Thank you. Thanks for having me. Take care, Hasan.
Thank you, Deidra. Bye-bye.
Bye.